Hello, hello. This is Dr. Shirlea North from North Star Physical Therapy, and today we're going to be talking about the abdominal canister, or really what abdominal breathing, diaphragmatic breathing, 360-degree breathing, what does that have to do with your abdominals, what does that have to do with pressure management, what does that have to do with certain pelvic floor dysfunctions or conditions that we have. Whenever we are talking about the trunk, okay, your abdominal area, but really when I talk about the trunk, I'm talking about everything from your neck to your pelvis, front, back, and sides. So as people, we are a 3D object, right? We have a front, a side, a back to us. And so whenever we're doing true core workouts, core exercises, it isn't just about the abdominals, not just about the six-pack abs, right? We want to really focus on the entire core, the entire trunk. And a lot of that has to do with this canister kind of a presentation. And when you think of a canister or a can, you think of that 360 degrees, you think of that 3D object that it can expand up and down, front and back, and side to side. And when we apply that to our anatomy, that's what the ribs do. The ribs have like a bucket handle, so they go out to the side, and they also expand front to back. The muscle that's within the rib cage there, that's on the bottom of it, is our diaphragm. It's a huge, broad muscle that when we inhale, it goes down towards our pelvis and flattens out. And when we passively exhale, it recoils back up into our rib cage. When you do a forceful exhale, like you're blowing on a candle, you're blowing one of those like pinwheel toys, like something like that through pierced lips, you then are also engaging your abdominal muscles. And so this helps with proper pressure management within your canister, within your core, within your abdominal canister there, okay? Within your trunk. When we have properly managed our pressure within our trunk, within our core, within our abdominal region, we have less likelihood of having pelvic floor dysfunctions like pelvic organ prolapse, urinary incontinence, constipation. We also can, take a deeper breath so we can maybe last a little bit longer or work a little bit harder with our exercises and workout. We have less low back pain or mid-back discomfort. And our ribs expand all the way from the base of our neck. Our first rib is actually above the collarbone. And then our second rib is right below the collarbone. And then you go down to all 12 ribs. And so if our ribs aren't moving, then we could have joint stiffness throughout our back. So sometimes some of the dysfunctions or some of the conditions are all stemmed from how we're breathing. So I think a lot of times when people come to pelvic floor physical therapy for a pelvic issue and we are first working on breathing, they don't really get that connection. And so we often have to always go back to anatomy. What does the body tell us? How is the body structured? How should it move? And why is it not happening that way within that person? So oftentimes we're talking about this 360-degree breathing technique so that we can properly manage pressure so that we can make some really great gains with symptom resolution and relief within those pelvic dysfunctions there. But then also with that low back pain or with that joint stiffness, like in your ribs. For example, if a client is postpartum and with that hormonal drop of the estrogen and progesterone when you went into labor and to have the child, there is a joint stiffness and a soft tissue tightness and increase in tension. And so we often feel super stiff, right? And especially for those that are breastfeeding or carrying the baby, you're getting all this arm strength. But then if our posture isn't the greatest, our joints are really tight because of that hormonal change, we probably aren't breathing the best. Our ribs are stuck. And then with those that were pregnant, the ribs have to flare throughout the pregnancy to make room for the growing fetus and baby. And so the ribs get stuck out into that out flared position or in that inhaled position. And it's really hard to bring them back in when there's something in the way. And so oftentimes one of the first things I train for postpartum people is the breathing technique to help pull those ribs back in, to have the diaphragm really engage, to have the abdominals really engage in a coordinated way to help prevent any potential pelvic floor issue or prevent any continued joint stiffness and back pain, to help with optimizing their breathing pattern, optimize the intake of the oxygen, all these little things just from breathing. And so sometimes I get these little like snickers or like the rolling of the eyes from clients when we are just focusing on breathing maybe for the first session or two. And it's to try to help bring that intention, to help with, okay, this is how you're breathing during this certain activity. Our goal is not, you're going to be breathing 360-degree technique for everything. You're not walking around the grocery store, okay, inhale, exhale. No. How we breathe changes with whatever activity we're doing. But if we want to help re-engage and coordinate things, especially after, like during postpartum, after any abdominal surgery, if you've been diagnosed with maybe diastasis recti, and that could be for not just postpartum people, but then also like for gentlemen that have an abdominal hernia, right? Or inguinal hernia. So that's not just a female thing, but we want to really help train that breathing pattern so that way the abdominal canister, the trunk, the core can be optimally mobilizing, also can be optimally stabilizing, and can help with pressure being properly managed so that way the pressure isn't going straight down into the pelvis, which could cause further issues and symptoms. So I often am working on posture, joint mobility, and breathing technique within the first couple of weeks postpartum. So that way when we progress activity, we can hone in on that breathing technique to help engage potential pelvic floor muscles, to help engage those abdominal muscles that were stretched throughout the pregnancy. But again, this isn't just for postpartum. This is also for a variety of other populations and individuals that have other pelvic floor symptoms, or again, just having back pain. And so, especially for those that are sitting at the computer a lot for their workday, posture is a huge issue here. There are some people that are so tight, and we maybe need to do the opposite. Maybe their ribs are so bound down that we need to help with that expansion, to help with that relaxation of the pelvic floor, of the diaphragm, or just rib mobility in general. This 360-degree and abdominal canister is just a good visual kind of cue that you can utilize to help with that proper pressure management, to help that breathing. So again, the engagement of your diaphragm and your abdominal muscles also are coordinated with your back muscles and with your pelvic floor. So that's where like the canister, the 360 degrees comes from. So the top is the diaphragm, the bottom is the pelvic floor muscles, the back are the low back muscles, and the front are the abdominal muscles. And the four sets of muscles have to work together and coordinated well for that proper pressure management and 360-degree breathing. When one group is only being worked on, like when you're thinking of core exercises and core strengthening, and you're just thinking abdominals, you might be compensating elsewhere, or you may not be breathing appropriately where the abdominal muscles aren't being fully optimized. So that's when I think of core exercises, I'm thinking the whole canister. And so that's where maybe sometimes you're with your trainer or with your pelvic floor physical therapist, and they're telling you how to breathe during a certain exercise. It's for that kind of engagement. And there's sometimes I have a client that they'll come in, oh yeah, my trainer tells me like to breathe this way. And okay, maybe it's not really correct. Or once you add on resistance, your breath might be a little different. Or I have a postpartum mom as a client right now who is a weightlifter or a CrossFitter. And so how they breathe when they're doing their heavier lifting is going to be a little different than if they're doing like a bridge exercise or if they're running. Like, we're not doing these really slow, intentional 360-degree breathing when we're running, right? That breath is totally different because the activity is totally different. Yes, part of pelvic floor physical therapy is breathing techniques, not just for the peripartum person when they're preparing for labor, what that breathing technique is versus 360-degree breathing versus diaphragmatic breathing versus there's all these different kinds of breathing techniques. And it's the real question is the why. And so when we're looking at this abdominal canister, when we're looking at the 360-degree breathing, we need to know what activity we're doing and the why behind it. And it seems maybe now a little more complicated. Like, look, Dr. North, I can only think of one thing at a time. It's okay, we're going to hone in on that one thing, right? And we're going to practice until it becomes muscle memory. So, for example, a squat. If you really want to hone in on proper breathing technique, you're going to inhale on the way down and exhale on the way up, okay? Like back up to standing. If the intention is to help engage the abdominal musculature along with maybe a Kegel potentially, and that's when I call it more like a functional Kegel than like an isolated one, right? Because we're using all coordination in that movement. However, if I have somebody that we need to work on relaxation on the pelvic floor, like they're too tight there, and so we really are honing in more on the inhale on the way down, and then there's a passive exhale on the way up. Okay, so that's just one example, and it's all about the intention behind the why. Why is the reason for the exercise, and then why we're focusing on what part of the breathing pattern. And so as you're doing that over and over again, and you're practicing it outside of therapy sessions, and you're tying it into your everyday. I mean, how many times we do a squat movement throughout the day, picking up things, picking up the kids' toys, picking up the laundry basket, picking up like work material, putting it into your car, picking up the pen that fell on the floor. We're doing a lot of these kind of squat-like movements throughout the day. And so I'm like, all right, so every time you do that, I want you to pull in the intention that we had behind the exercise in therapy. And the more you're able to carry that over, the more the muscle will just remember, and you're going to become like second nature. And then now let's progress it. Now let's add on resistance. Now let's add on a weight, like things like that. So we just want to reiterate that the abdominal canister, that 360-degree breathing, is used very widely within the pelvic health community, but the why behind it and the part that needs to be focused really needs to be individualized to the client's presentation, to their symptoms, and what's going on. So all more reason to go find a local pelvic floor physical therapist to help you through your symptoms and to help guide you in the right kind of treatment, the right kind of breathing pattern, to utilize the entire canister, to utilize all of that depending on the activity that you're doing. All right. And if you have any comments or questions, or if you're not sure about that, that is something that we can definitely do a virtual consultation, and now offer that at North Star Physical Therapy. So to help coach people through that, even on virtual sessions, so that way you can get started on that as soon as possible while you're trying to find somebody, close to home to be in person with. But know that virtual consultations are definitely available, because we want to have that access to care and access to that information and individualize it to you and your needs. All right. So I hope this was a good help of really realizing what the core is, what the abdominal canister is. And until next time.